NBC senior reporter Brandy Zadrozny covers online misinformation. We're also joined by Dr. Kavita Patel. Dr. Patel is a fellow at the Brookings Institute, former Obama White House policy director. She's also an MSNBC medical contributor. And Dr. Patel, let's start with you. When patients come to you and they tell you that they're not going to get the vaccine, what's the most common reason?
Yeah, Craig, good to be with you. It's an important topic. The most common reason that I'm hearing, and it is from young women, is that they're concerns about effects on current fertility or future pregnancies and altering the DNA, citing, by the way, Craig, on social media, information about scientific articles that support that theory. That's one of the most common. And then the second most common is that, it's too early. These were rushed. These aren't even approved by the government. I don't believe that they are safe, and they cause more harm than benefits because we're young and healthy and don't get sick. So those are two overriding concerns I hear practically from patients.
And when they say that to you, Dr. Patel, what do you say?
Yeah, you know what, Craig? Look, I've become a student of social science because my original approach was not working. I was pulling out articles, trying to cite the facts. I'll be honest, one of the approaches I've now really tried to employ is by really empathizing and just trying to understand what is underlying some of what they're telling me. And then actually going a step further, for example, saying, you know what, you're right. I actually do think that this is a much shorter time frame that we've seen these vaccines. But let me tell you about how many lives that we know it saved and talk firsthand about people before vaccination and after vaccination that got exposed to COVID. So I would just say empathize and understand before you try to correct it. And then it also addresses, Craig, there's serious gravity to this misinformation that I do not think is correctable with just science and facts. We have to inject a little bit more of understanding where they're coming from and showing them and meeting them where they are.
Brandy, I want to play part of something that White House Chief of Staff Ron Klain said on the New York Times podcast, Sway. It's about vaccinations and bad information that's shared on Facebook. Take a listen.
But I've told Mark Zuckerberg directly that when we gather groups of people who are not vaccinated and we ask them, why aren't you vaccinated? And they tell us things that are wrong, tell us things that are untrue. And we ask them where they've heard that. The most common answer is Facebook.
Facebook, Brandy, Facebook. I can't imagine you're surprised to hear that. But when it comes to vaccines specifically, why are these rumors so powerful? What makes them so viral?
Yeah, I'm not surprised at all. When we see the rumors that Dr. Patel just mentioned, we can almost always track them back to the platforms. That's definitely true for the fertility misinformation. As for why they're so powerful, they play on people's biggest fears, right? The death or injury of you or a loved one. But that you have to combine that with a couple of things. One is the widespread mistrust of media like you and me. And deep political polarization. But then you also have to combine it with the way social media works and the social media strategy for amplifying and spreading the worst content. And with all of that, it's just a recipe for virality and stickiness.
But you always hear and read about Facebook and these other social media sites taking steps and employing armies of people to stop the spread of misinformation, of downright false information. And it's not just Facebook. I mean, WhatsApp apparently has become wildly popular with regards to spreading misinformation about vaccinations. Are there things that these companies can do that they're not doing?
That's a really good question, and it's tough because the anti-vaccination messaging is incredibly powerful. It's often spread with stories of injured women and people who are saying that they've been injured that we can't fact check, right? But it's partly because of the way it spreads. So we tend to blame a few bad actors, a few of the sort of entrepreneurs who've made a big audience for themselves on Facebook and YouTube and Instagram. But that's not really how this stuff spreads, right? It spreads via your Crunchy Moms group or your local PTA group, or you get a new video that's just like automatically shown, like served up to you. So one thing that a researcher did tell me that platforms could do that they're not currently doing is work together. And it sounds really easy, but they don't currently do that. And what it was described to me as is sort of, if you have an ant problem in your yard and you clean it up, that's fine. But what happens is that the ants will just crawl into your neighbor's yard. And that's what happens with this misinformation, is it jumps platforms. And so researchers tell me that it's a cross-platform problem and it requires a cross-platform approach. And we just currently don't see that.
Not to oversimplify, but wouldn't it also be helpful if folks were just a little bit more discerning, a little bit more skeptical, not believing everything they see or read in a Facebook chat room or a text that they get from a friend in WhatsApp? I know it's not really a question, Brandy. That's just more of me.
Your lips to God's ears. It is my prayer each night, believe me. But it is hard because social media is very, very new. And it's a way to connect with people and access information that's just never been around before. And people are just sort of getting used to it. It's hard to blame people in that way. It's really a lot easier, I think, is to put that responsibility on social media platforms and say, how can you be good stewards of information? But I get you.
Dr. Patel, I want to read you a Missouri hospital leader's strong message to people who are spreading vaccine rumors. This is Cox Health CEO, his name's Steve Edwards. He recently tweeted, quote, "If you are making wildly disparaging comments about the vaccine and have no public health expertise, you may be responsible for someone's death. Shut up." His words, not mine. How much of an influence, Dr. Patel, can local medical voices like this hospital CEO have?
Yeah, I saw that tweet too. It went viral itself. And number one, I think that it's probably very important for that hospital CEO to have a mandate in place for his or his employees. And I think that's bringing up these critical issues that some of this just has to be overcome by requirements. But to your question more directly, I'm not so sure that saying shut up is going to get through. I mean, just everything I've been doing on the ground is, if you do that, it just puts up more barriers. I think it's much better and harder, Craig. People spend more time on Facebook than they do talking to me in a 15-minute visit. But it's much better to have a local medical person who knows that individual say, I get it. Like, I would be worried about the same things. And here's a little bit more information, but we'll never know everything. And then emphasize all the things that are positive. Once you get vaccinated, you're not going to have to wear masks. You're really not, required to do certain things if you're in contact with somebody who's had a virus. You are healthy. You probably will be healthy, but you don't want to play a role in getting one of your older family members sick. And so I'm not using the be quiet, you're wrong, I'm right. It's not getting through. That's why we need to employ a different tactic.
Dr. Kavita Patel. Dr. Patel, we'll continue the conversation for sure. Brandy Zadrozny, who spends so much time out there on the dark web for us. We appreciate your work, and I'm especially a fan of that artwork over your left shoulder. It looks like children's artwork. I have a lot of that in my home as well.